Hi, my name is Aaron Bodette, and as I said before, I'm going to put up a series of videos aimed at helping you with Medicare, health plan, drug plan, supplemental questions and answers. If you need some help, you can reach out, but this is designed to be informative so that you're aware of all the resources out there. I've said before, Medicare.gov is a tremendous resource. So this video is going to be tailored or designed for a kind of global perspective, maybe a 1,000-foot view, if you will, on who and what type of extra help, government assistance, financial assistance for things like copays on doctor visits and hospitals and drugs, co-insurance, deductibles, and premiums are available. So there is a lot of assistance out there. Some are federal programs, some are state programs, some are combinations. I meet with a lot of people. I've been doing Medicare health plans and drug plans and supplements for 28 years. And I see people who live on a lot, and I see people who live on very little. So this is something that's kind of important because people don't really know where these resources are, and hopefully I can point you in the right direction. As I say, Medicare.gov, top right, you can find out, you can get some information on Medicaid. I mean, what is Medicaid? Medicaid is a program that if you qualify for, everything, will give you pretty good benefits with Medicare. It'll usually have zero copays and zero premiums and very low cost on drugs. $3.35 or $8.35. It makes things really cozy. If you have both Medicare and Medicaid, there are many levels of help. Maybe you don't qualify for full Medicaid. Maybe you qualify for a portion of it. But it's important to know that you should check. You should check it out because you never know. If you're fully Medicaid and Medicare eligible, they call you a dual eligible. And I have seen programs out there that offer additional benefits such as, rides to and from your doctor's office, dental, vision, hearing aids, 24/7 nurse line. I mean, there's a lot of additional benefits that you may have access to depending upon where you live. So say this is just informational. I'm trying to point you in the direction of searching. Medicare.gov is one place. You can go down to the Social Security Administration. You can call them. In my county, I work between New York and New Jersey primarily, although I'm licensed in many states. There's an Office of the Aging, and they are extremely helpful, extremely helpful. The next level up, if you don't qualify for full Medicaid, there's another program called Medicaid Spend Down, where if you spend a certain amount of money per month, then you qualify for Medicaid benefits. Maybe you would fit into that category. And even beyond that, there's a program called Medicare, MSPs, Medicare, I forgot the name of it all of a sudden, Savings Plan, Medicare Savings Plan. And what they do is they help offset, the Part B premiums that Medicare takes out of your Social Security check. So just be aware of that. There are things going on that, we're not experts in that, you should check into. For instance, I've seen many people who have had assistance in creating this financial document for these programs. They look at finances, they look at income, they look at assets, but they also look at expenses. And I had many situations where somebody was going to the doctor an awful lot, and the copays were pretty high, and these people sometimes they won't go to the doctor. In some Medicare supplemental environments, there are low or no copays. So what these folks at the Office of the Aging did was they looked at the expenses, and they determined that if this person were to buy a particular Medicare supplement where there were no copays, it would actually drop their income below the threshold for the Medicare Savings Plan, which saved them $134 a month, which is the premium he was paying for Medicare Part B. Yes, the supplement that he bought cost more than that. However, he didn't have those copays at the doctors anymore because they were Medicare covered services. So these are the type of creative, out of the box people I think we need to, or you need to seek out. If you're watching this, you probably are curious about those things. There's a number of other programs, PACE, which I'm not very familiar with. There's also what they call low income subsidy or extra help. These programs are for, again, low income individuals who may not qualify for Medicaid, Medicaid spend down, or Medicare savings plan. Maybe they do, but maybe they don't. Their income's a little too high, but they may be able to get low income subsidy. This is a pretty good program because if you qualify for that, it changes your drug copays. As long as your drugs, are covered by your Part D plan, it maximizes them at $3.35 for generic, according to Medicare.gov, and $8.35 for brand name drugs. They will, if you qualify for low income subsidy, they will also subsidize your Part D drug plan to a certain threshold, up to their benchmark, which changes every year. As do these cost sharing arrangements. They can change as well. Just be aware of that. There are different levels of low income subsidy. I would urge you, even if you think you may not qualify, to find out if you qualify, because it's I've seen people earning $25,000 a year as a couple, and sometimes even more, qualifying for these programs. I mean, it can be a struggle. Some people struggle at $600 a month. Some people struggle at $2,000 a month. I mean, some people struggle at $4,000 a month. You just never know, some of these struggles, but I know that their income is fixed, and it can be problematic for them, spending money on these things. Be aware that I have seen many times somebody who is not on Medicare who has Medicaid. They're aging into Medicare, meaning they're going to be 65 soon, and they have Medicaid. And even if they're not completely enrolled in Medicare yet, when they turn 65, they will be, and the system automatically shows us that they are what they consider dual eligible because they have Medicaid, and now they're going to have Medicare. And one of the issues I've seen with this is that the criteria for Medicaid when you're not on Medicare versus the criteria when you're on Medicare is different. So I've seen people have what they call special needs plans, which are plans designed for people who have Medicare and Medicaid. I've seen them go onto those plans and then get kicked out of them a few months later because Medicaid typically sends out a questionnaire soon after their entry into Medicare to make sure that they still qualify. So things are a little different there. Just be aware of that. There are also, as I spoke about in my last video, state pharmaceutical assistance programs that you should be aware of. Some states have them, some states don't. But if you query in the Google box SPAP, S-P-A-P, or State Pharmaceutical Assistance Program, you can find out what's out there in your state. As I said before, in New York, they have a great program. It's called EPIC, E-P-I-C, where if you're married making under $100,000 a year, you can qualify. If you're single making under $75,000, you can qualify. So if you're anywhere below those thresholds in the state of New York, currently you can qualify. And it can be a big help. The lower your income, the more it will help you, and the faster that it will help you. They have, once you meet their, trigger their benefits, which can either be by paying a premium or having meeting your deductible, then you pay no more than $20 for any drug, providing it's covered by your Part D plan. So there's a lot of moving parts here. Just be aware, which is the purpose of this video, that there's a lot of extra help. There's a tremendous amount of help, and I would suggest that if you are, between 25 and 30,000 or lower, anywhere lower, that you should go and check it out, because you never know if you're going to qualify for something. And it's better to do it when you really don't need it than when you do need it, but I guess either way, it's important. Some people who have specific drugs many times approach the drug companies themselves and can show some sort of financial hardship, and even those companies will help them directly to get on their medication. But a lot of people, don't go pick up their medications. I've seen it. A lot of people, won't go to the doctor as often as they should because of the copay structure or what they'll have to pay, and that's uncomfortable for them. So again, just be aware that there's a tremendous amount of assistance on a federal, state, and combined level. And I think you should seek out the guidance of somebody who's specifically helping in those areas, whether it's your Office of the Aging, it's calling Social Security, it's going down to the Social Security office, it's calling Medicare or going onto the Medicare.gov website and filling out an application. Find out what kind of extra help you can get, and it may be just the assistance that you need. And again, I hope this was helpful. I'm going to be putting up a series of informational videos because I've been doing this a long time. I've met with thousands of people over the years. Man, I've seen it all, from the farmer who's, making barely anything, to, retired physicians. And I know this is confusing. I'm aware of it. I've met people with PhDs who don't understand how Medicare works or their health plans. So it's easy to get confused. I don't know that it's designed on purpose that way, but it's just the way it is. So thanks, I'm Aaron Bodette, and please come back. I'm going to have some more helpful information as time goes on.